A burn is an injury to the skin or other organic tissue caused by heat, radiation, electricity, friction, contact with chemicals, or sunburn. Human skin can tolerate temperatures up to 42 to 44 degrees Celsius. Changes are generally reversible below 45 degrees Celsius, but higher temperatures lead to proportional tissue destruction. Above 45 degrees Celsius, protein damage exceeds the cell's repair capacity. In the UK, around 175,000 people visit the emergency department annually for burns, with about 13,000 needing admission. In the US, about 2.4 million people suffer burns annually, resulting in 700,000 emergency room visits. Globally, 8,000 to 12,000 burn patients die each year, and approximately 1 million sustain substantial or permanent disabilities. Fire ranks 5th among accidental injuries, following motor accidents, poisoning, falls, and drowning. The majority of burns in children are scalds. Adolescent burns are often due to experimenting with flammable liquids. In adults, scalds are common, but flame burns are more frequent. Electrical and chemical injuries usually occur in adults. Cold and radiation are very rare causes of burns. Predisposing factors include mental disease, epilepsy, alcohol, or drug abuse, contributing to burns in as many as 80% of admitted patients. The most common organ affected by burns is the skin. Burns can also damage the airway and lungs, which can be life-threatening. Airway injuries occur when the face and neck are burned. The pathophysiology of burns includes local effects on the skin, systemic effects, physical injury to the airway, inhalational injury, metabolic poisoning, and mechanical block on rib movement. Jackson's theory of thermal wounds describes 3 zones. The zone of coagulation is the area nearest the heat source, with maximum damage. The zone of stasis surrounds this area and has moderate insult and hypoperfusion. The 3rd zone is the zone of hyperemia, which is viable tissue surrounding the burn. This area has increased blood flow and is not at risk for further necrosis. Physical burn injury to the airway above the larynx can cause swelling of the nose, mouth, tongue, palate, and larynx, potentially leading to complete airway obstruction if not secured. Burn injury below the larynx is rare, but can occur with steam inhalation due to its large latent heat of evaporation. This can cause the respiratory epithelium to swell and detach, creating casts that block the airway. Inhalational injury is caused by minute smoke particles reaching the lung parenchyma, leading to intense reaction and edema in the alveoli. This chemical pneumonitis decreases gaseous exchange and can result in bacterial pneumonia. Metabolic poisoning is often caused by carbon monoxide, a product of incomplete combustion. CO binds to hemoglobin with a 240 times greater affinity than oxygen, blocking oxygen transport. Carboxyhemoglobin levels above 10% are dangerous and require treatment with pure oxygen. Another metabolic toxin is hydrogen cyanide, which causes metabolic acidosis by interfering with mitochondrial respiration. Burned skin is thick and stiff. A large, full-thickness burn across the chest can physically stop the ribs from moving, leading to a mechanical block on rib movement. Inflammatory changes occur when burned skin activates inflammatory cascades. The release of neuropeptides and complement activation, along with Hageman factor activation, initiates several protease-driven pathways. At a cellular level, complement causes mast cell degranulation, attracting neutrophils. Neutrophils release free radicals and proteases, causing further tissue damage. These factors alter blood vessel permeability. Increased permeability allows large protein molecules to escape. This, along with damaged collagen, increases oncotic pressure in the burned tissue, causing a net flow of water, solutes, and proteins from the intravascular to the extravascular space over the first 36 hours. While this reaction is localized in small burns, if the burn size approaches 10 to 15% of the total body surface area, the loss of intravascular fluid can lead to circulatory shock. In summary, inhaled hot gases can cause supraglottic airway burns. Inhaled steam can cause subglottic burns. Inhaled smoke particles cause chemical alveolitis. Inhaled poisons, like carbon monoxide, cause metabolic poisoning, and full-thickness chest burns can mechanically block rib movement.